Welcome to the second in our video series on HIV and related issues. As patient-centered medical homes, health centers must fully engage patients, families, and communities in addressing these vital issues. Here we see how one center integrated effective HIV screening into daily operations.
Some of the patients we had been caring for years were HIV positive, and we had failed to test them. So that when our first positive tests were people who were already our patients. It's easier than you think it is. We went into this thinking this was going to be very difficult, that it might slow down the primary care appointment, and what we found out was it does not slow down a primary care appointment, and it really does flow seamlessly with the other things that happen in a primary care appointment. We had done a lot of planning, we had done a lot of training, and we just picked a date. So that day, we started offering HIV screening to our patients, and we waited to see what the issues would be, and it turned out there really weren't that many issues. I think the planning is really important. We knew we wanted to do rapid testing so everyone would receive their result. We also knew that it had to fit within our primary care appointment. So what we did was we identified a test that takes 10 minutes to process. The medical assistant goes in the room when they're rooming the patient. They get the consent for the test while they are rooming the patient. They answer questions. They get the blood sample, which in the case of this test is a finger stick. They take it into our lab where they start the test running. They set the timer, and they take the timer with them. So whenever that timer goes off, they are ready to go into the lab and read the test. And what we find is usually the test result is ready before the provider goes in the room, and it works very seamlessly.
Other community resources and patients themselves can be vital in making these programs work.
Another thing I would want health centers to know is the importance of that linkage to care. And I would encourage health centers who do not have HIV care programs to use the resources that are in your community. We contacted the Department of Health and said, we have this program that we want to launch. We have the expertise, and we would like to talk to you about partnering. And it has turned out to be a great partnership. We might have marketed this routine HIV testing more to our patients. We assumed we would have to win them over, but in the end we found that our patients were some of our best ambassadors, and they were telling their friends about it.
Ryan White programs, other local resources, and patients themselves make effective community partners in addressing HIV. Finally, please note that a good model for routine HIV screening is also available on NACHC's website.